Hello and welcome back to the Baby Boomer Blueprint, where we make complex topics simple and senior-friendly. If you've ever felt confused about Medicare, what's Part A, what's Part D, and why there's even a Part C, you're not alone. Medicare can feel like trying to decode a government puzzle, but today, we're cutting through the noise. In this video, I'll break down the 4 parts of Medicare, A, B, C, and D, so you know what each one does, what it costs, and how to choose what's best for you. We'll also cover the most common mistakes to avoid and questions every boomer should be asking. So whether you're new to Medicare or just trying to understand what you're already paying for, stick around. You'll walk away with clarity, confidence, and probably a few saved dollars. Let's get started. Let's begin with Part A, hospital insurance. Think of Part A as the part of Medicare that kicks in when you're admitted to a hospital. It covers things like inpatient hospital stays, skilled nursing facilities, hospice care, limited home health care. Sounds pretty comprehensive, right? Well, here's what you need to know. Cost. For most people, Part A is premium-free. That's because you or your spouse paid into Medicare for at least 10 years through payroll taxes. But free doesn't mean no cost at all. You still have out-of-pocket costs, like a deductible. In 2025, it's around $1,700 per benefit period. Daily coinsurance if you stay in the hospital for more than 60 days. Additional fees for skilled nursing after 20 days. Also, and this is important, Part A does not cover long-term care. So if you need help with daily living, like bathing or dressing, Medicare won't pay for that unless it's medically necessary and short-term. One more thing, home health care through Part A is only covered if your doctor says it's medically necessary after a hospital stay. Bottom line, Part A is your safety net for short-term hospital-related care. But it's not long-term coverage, and it's not totally cost-free. Now let's move on to Part B, medical insurance. This is what helps pay for doctor visits, outpatient care, preventive services like mammograms, flu shots, and screenings, durable medical equipment like walkers or oxygen. Think of Part B as your everyday healthcare coverage outside the hospital. Cost. In 2025, the standard monthly premium is around $174.70, but it could be higher based on your income. There's also an annual deductible, about $250 in 2025. 20% coinsurance for most services after you meet your deductible. So, if you go to the doctor or get a test, you'll generally pay 20% of the cost. Now, here's where many people get tripped up. You must actively enroll in Part B when you're first eligible, unless you're still working and covered by an employer plan. If you delay enrollment without qualifying coverage, Medicare can charge you a lifetime penalty, 10% more for each year you delay. That adds up fast. What's covered? Part B covers things like labs and x-rays, mental health services, outpatient surgeries, some home health care, but it doesn't cover most dental care, vision exams for glasses, hearing aids, routine foot care. Bottom line, Part B is essential if you want access to doctors and outpatient care. You'll pay a monthly premium and 20% of most costs, but skipping it can cost you even more down the line. Now let's talk about Part C, also known as Medicare Advantage. This one confuses a lot of people, so let's break it down slowly. Medicare Advantage is an alternative way to get Medicare. It's offered by private insurance companies approved by Medicare. When you join a Medicare Advantage plan, it replaces your original Medicare, Parts A and B, but you're still part of the Medicare system. These plans must cover everything original Medicare does, but they often include extras like vision, dental, hearing, prescription drug coverage. Yes, some include Part D. Wellness programs, transportation services. Why do people choose it? A lot of folks go with Medicare Advantage because premiums are often lower than paying for Part B plus a separate drug plan. Plans often have an out-of-pocket maximum. Original Medicare doesn't. They like the convenience of bundled services. But here's the catch. You usually have to stick with a network of providers, like an HMO or PPO. If you travel a lot or want to see any doctor you choose, Advantage might not be for you. Also, plan quality varies a lot by zip code and insurance company. Some are excellent, others, not so much. Cost. The premium varies by plan. Some are $0 per month, but that doesn't mean zero cost. You still pay the Part B premium and other co-pays or deductibles. Make sure to read the fine print. Bottom line, Part C is great for people who want a one-stop shop with extra benefits and are okay with using a provider network. Just shop carefully and compare the plans in your area before signing up. Now let's finish with Part D, your prescription drug coverage. Part D is optional, but highly recommended if you take medications, even if only occasionally. These plans are run by private insurance companies and help pay for brand name drugs, generic drugs, some vaccines. How much does it cost? Monthly premiums vary by plan, anywhere from $10 to $100 plus percent. There may also be an annual deductible and co-pays or co-insurance at the pharmacy. You can get Part D in one of two ways: as a standalone plan, if you're on original Medicare, included in a Medicare Advantage plan, Part C. Now, here's the important part. If you don't sign up for Part D when first eligible, and you don't have other creditable drug coverage, you'll pay a late enrollment penalty for life. That penalty gets added to your premium every month. So even if you're not on medication now, it might be worth enrolling in a low-cost plan just to avoid the penalty. What does it cover? Each plan has its own formulary. That's a fancy word for the list of drugs they cover. Always check if your prescriptions are on the plan's list before enrolling. Also, be aware of the coverage gap, sometimes called the donut hole. It's a temporary limit on what the plan will pay. It's not as bad as it used to be, but it can still affect you if you have high drug costs. Bottom line, Part D helps cover your medications. Don't skip it, and compare plans carefully based on your current prescriptions. All right, let's recap all of that in a clear, easy way. Part A is for hospital stays. It's usually free, but you'll still pay deductibles and co-insurance. Part B is for outpatient care, doctor visits, tests, and more. You pay a monthly premium and 20% co-insurance. Part C is Medicare Advantage. It's a private plan that combines A and B and often D. Great perks, but with networks and varying quality. Part D is for prescription drugs. Optional but highly recommended, especially to avoid late penalties. So what should you do next? Review what coverage you already have. Use Medicare's Plan Finder to compare plans in your area. Be mindful of enrollment deadlines. Late fees can stick for life. Don't assume cheaper is better. Look at total costs, networks, and coverage. And finally, talk to a licensed Medicare advisor or local SHIP counselor if you're overwhelmed. They're free and trained to help. Remember, Medicare isn't one size fits all. The best plan is the one that matches your health needs, your finances, and your peace of mind. Thanks for watching the Baby Boomer Blueprint. If this helped you, give it a like and share it with someone else navigating Medicare. And don't forget to subscribe. We've got more guides coming to help you age smarter, not harder. See you next time.